Welcome everyone. Today we're diving deep into the world of viruses, specifically focusing on a common but potentially serious illness, influenza, or as many of you know it, the flu. Viruses are fascinating, albeit slightly pesky, microorganisms that have been our planet's cohabitants for millennia. They are incredibly diverse and can cause a wide range of illnesses, from the common cold to more serious diseases. Understanding how viruses work and how they spread is crucial in our fight against infectious diseases. Knowledge, as they say, is power. So, let's empower ourselves with information about influenza and how we can best protect ourselves and our communities. Stay tuned as we unravel the mysteries of influenza, explore its symptoms, delve into treatment options, and discuss the role of vaccination in preventing its spread. Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. These viruses primarily attack the nose, throat, and sometimes even the lungs. Influenza is notorious for its ability to spread rapidly, especially during the colder months. It's important to remember that influenza is different from a cold, even though some symptoms might overlap. Influenza often comes on suddenly and can be much more severe than a common cold. While anyone can get the flu, certain groups like young children, older adults, and people with chronic health conditions are at a higher risk of developing complications. Understanding the difference between a cold and influenza is crucial for seeking timely medical attention and preventing the spread of this contagious virus. Influenza often announces its arrival with a sudden onset of symptoms, making it distinct from the gradual development of a common cold. These symptoms can vary from person to person, but some telltale signs include a high fever, often exceeding 100.4 degrees Fahrenheit, accompanied by chills that can leave you shivering. Muscle aches and pains, particularly in the back, arms, and legs, are common complaints, making even simple movements a tiring endeavor. A persistent headache, often described as throbbing, can add to the discomfort, making it difficult to focus on daily tasks. A dry cough, which can be persistent and irritating, often accompanies influenza, along with a sore throat that can range from scratchy to painfully inflamed. Weakness and fatigue are also hallmarks of the flu, leaving you feeling drained and lethargic. Unlike the common cold, influenza can sometimes lead to more serious complications such as pneumonia, especially in individuals with weakened immune systems or underlying health conditions. Treating influenza typically involves a multi-pronged approach aimed at relieving symptoms and supporting the body's natural healing process. Rest is paramount, allowing your body to direct its energy towards fighting off the virus. Staying well hydrated by drinking plenty of fluids such as water, clear broths, or electrolyte solutions is crucial to replenish fluids lost due to fever and prevent dehydration. Over-the-counter medications, such as acetaminophen or ibuprofen, can help reduce fever and alleviate muscle aches and pains, providing much-needed relief. Antiviral medications, such as oseltamivir, Tamiflu, or zanamivir, Relenza, are sometimes prescribed by healthcare providers, especially for individuals at higher risk of complications or those experiencing severe symptoms. These medications work by inhibiting the influenza virus's ability to replicate within the body, potentially shortening the duration of the illness and reducing the severity of symptoms. It's important to note that antiviral medications are most effective when started early in the course of the illness, ideally within 48 hours of symptom onset. Section 5. The influenza vaccine, your shield against the storm. The influenza vaccine, often referred to as the flu shot, stands as a cornerstone of public health measures aimed at reducing the burden of influenza infections worldwide. This vaccine works by triggering the body's immune system to produce antibodies specifically tailored to fight off influenza viruses. These antibodies act as sentinels, patrolling the body and neutralizing the virus before it can establish a foothold and cause illness. It's important to note that the influenza vaccine typically contains inactivated or weakened forms of the virus, making it impossible for the vaccine itself to cause the flu. The composition of the flu vaccine is carefully reviewed and updated annually by healthcare organizations like the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, to ensure that it provides protection against the influenza virus strains that are most likely to circulate during the upcoming flu season. Getting vaccinated not only protects you, but also contributes to the collective immunity of your community, making it more difficult for the virus to spread. Section 6. Debunking vaccine myths, separating fact from fiction. Despite overwhelming scientific evidence, vaccine myths cause fear and hesitancy. One myth is that the flu vaccine can give you the flu. This is not true. The flu vaccine contains inactivated or weakened virus forms. Mild side effects like soreness or low-grade fever are signs of immunity building. Healthy individuals should still get vaccinated to protect vulnerable groups. Vaccination contributes to a healthier and safer community. Section 7. Influenza vaccine. Who should consider it? The influenza vaccine is recommended for most individuals aged 6 months and older. High-priority groups include young children, older adults, pregnant women, and those with chronic health conditions. Healthcare workers and those in close contact with high-risk individuals should also get vaccinated. Section 8. Influenza vaccine, potential side effects. The influenza vaccine can cause side effects, but these are typically mild and short-lived. The most common side effect is soreness at the injection site. Some might experience low-grade fever, headache, muscle aches, or fatigue. These symptoms usually resolve within a day or two. Rarely, severe allergic reactions like hives or difficulty breathing can occur. These require immediate medical attention. Healthcare providers can manage and treat these reactions. Section 9. Protecting yourself and your loved ones. Protecting ourselves and our loved ones from influenza requires a multifaceted approach that encompasses both individual actions and collective responsibility. One of the most effective ways to prevent the spread of influenza is through frequent and thorough hand washing. Washing your hands with soap and water for at least 20 seconds, especially after coughing, sneezing, or being in public places, can significantly reduce the risk of infection. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used as an alternative. Covering your mouth and nose with a tissue or your elbow when you cough or sneeze is another crucial step in preventing the spread of respiratory droplets that can carry the influenza virus. Avoid close contact with people who are sick, and if you are feeling unwell, stay home from work, school, or social gatherings to prevent spreading the virus to others. Maintaining a healthy lifestyle by eating a balanced diet, getting enough sleep, and managing stress can also strengthen your immune system and make you less susceptible to infections. Section 10. The importance of early detection and treatment. The early detection and treatment of influenza are crucial in mitigating its severity and preventing potential complications, especially in individuals at higher risk of developing severe illness. If you experience symptoms of influenza such as fever, cough, sore throat, muscle aches, or fatigue, it's important to seek medical attention promptly. Early diagnosis allows healthcare providers to initiate appropriate treatment measures such as antiviral medications, which are most effective when started within 48 hours of symptom onset. Antiviral medications can help shorten the duration of the illness, reduce the severity of symptoms, and lower the risk of complications such as pneumonia. In addition to antiviral treatment, supportive care measures such as rest, hydration, and over-the-counter medications to relieve fever and aches are essential for managing symptoms and promoting recovery. Timely medical attention is particularly important for individuals at higher risk of complications, such as young children, older adults, pregnant women, and those with underlying health conditions. Prompt diagnosis and treatment can make a significant difference in their recovery and overall well-being. Section 11. Stay informed, stay healthy. As we conclude our exploration of influenza, it's essential to remember that knowledge is our most powerful tool in preventing and managing this contagious respiratory illness. Stay informed about influenza activity in your community by referring to credible sources of information such as the Centers for Disease Control and Prevention, CDC, or your local health department. These organizations provide regular updates on influenza trends, vaccination recommendations, and preventive measures. Remember that getting vaccinated annually is the single most effective way to protect yourself and your loved ones from influenza. Vaccination not only reduces your risk of getting sick but also contributes to the collective immunity of your community, making it more difficult for the virus to spread. By staying informed, practicing preventive measures, and seeking timely medical attention when needed, we can navigate the flu season with confidence and protect ourselves and our communities from this potentially serious illness.